Hello, and Ya Alimadat, everyone. Welcome to our Fall Immunity Boost Tips to Keep You Healthy this respiratory season webinar, a part of the Your Health is Your Wealth series. My name is Sarah Munji, and I'm a registered pharmacist practicing in Toronto, Ontario. I serve as a member of the Health Promotion National Programming Team on the Aga Khan Health Board for Canada, and I will be your moderator for today's webinar. The goal of this webinar is to share valuable information on respiratory conditions such as influenza, COVID-19, pneumococcal disease, and RSV. We will also learn about how we can stay healthy and protected during this time of the year. Our panel will discuss up-to-date information on preventing infections, vaccinations, and what to do if you are sick, including testing and treatment. They will also address commonly asked questions on these topics. Before we start, we would like to thank all the volunteers who have helped make this webinar possible. I'd like to start with the land acknowledgement, where we acknowledge the Indigenous peoples of all the lands that we are situated on today. While we meet today on a virtual platform, we would like to take a moment to acknowledge the importance of these lands, the ancestral and unceded territory of all the Inuit, Métis, and First Nations people across Canada that call this nation home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. Before we get started, we would like to inform the audience that any information that is provided in this webinar should not be considered specific medical advice and is not intended as a substitute for medical professional help, guidance, diagnosis, or treatment. We remind our audience to seek the advice of your physician or other qualified healthcare providers with any questions you have regarding your medical care. The healthcare panelists are not affiliated with any specific products related to this presentation, nor do they endorse them. I now have the pleasure of introducing you to our panelists for today's session. Dr. Zain Chagla is an associate professor at McMaster University, co-medical director of infection control at St. Joseph's Healthcare Hamilton, and a consultant in infection control at Woodstock General Hospital. During the COVID-19 crisis, Dr. Chagla contributed to local, provincial, and federal policy planning, and to several clinical trials on COVID-19 therapies. He has published works on COVID-19 research, epidemiology, testing, and infection control. Dr. Chagla has a Bachelor of Science and an MD from Queen's University. He also has a Master of Science in Infectious Diseases and a Diploma in Tropical Medicine and Hygiene from the London School of Hygiene and Tropical Medicine. Dr. Hamidah Meghani is a public health physician in Ontario. She has over a decade of experience in public health and the healthcare system. She was the Commissioner and Medical Officer of Health for the Halton region for almost a decade and led the health department during the COVID-19 pandemic. She is also an assistant professor with the Department of Health Research Methods, Epidemiology, and Impact at McMaster University. Dr. Meghani obtained her Doctor of Medicine from McMaster University and a Master's of Public Health from Columbia University and a Master's of Management from McGill University. We would like to thank you both for taking the time to be here with us today. Over to you, Dr. Chagla.
Thank you, Sarah, for that introduction. So happy to be here. And, as we talk about respiratory season, it's something, that happens every year. Many of us think a little bit of sniffles, coughs, and colds. But I think we have to understand that respiratory season can be quite serious for some individuals, can make them quite sick, can land them in hospital. And, even being out of commission for a few days and not feeling well for a few days, not being able to go to work, not being able to go to Jamaat kind of for a few days may also be a big deal for individuals. And so we are blessed to have many different interventions to really make sure that respiratory season is safe as possible for everyone. And so we're today going to go through many of those, and I'll turn it over to Dr. Meghani to start us off.
Thanks so much, Zain. Yali Madad, everyone. So, as a public health physician, the advice on how to stay healthy during respiratory virus season is really the same as what I would give to everyone for the other half of the year. It's similar advice, and it's basically some general maintenance of good health. So, that is, we should always stay up to date with our preventive measures. This includes ensuring that you're up to date with all of your vaccines based on your age, the type of work you do, and any medical issues that you may have. We also know that getting a good amount of sleep based on your age is very important. Eating healthy, things like more plant-based proteins and vegetables, less processed food, is another important way to stay healthy, along with refraining from substances such as smoking, vaping, and alcohol. Finally, to round out this combination of lifestyle measures, it's important to stay mentally and physically active. Physical activity is known to not only improve your physical health, but also improve mental well-being. And other important measures to take to prevent getting ill from viruses and bacteria are to clean your hands frequently. Carry a bottle of sanitizer with you and wash your hands with soap and water, especially when they are visibly unclean. Once you do get sick, it's important to protect yourself from getting worse by resting at home and getting treatment if you are eligible. Then protect others by staying home while ill, and if you need to go out into public spaces, wear a well-fitted mask in those spaces for 10 days after your symptoms have started. Many people ask why we should mask now that the pandemic is over. Well, unfortunately, COVID-19 and other respiratory viruses are here to stay with us and continue to make people ill. Masking, as we've learned during the pandemic, is a very safe way of protecting oneself and others. It's one layer of protection we can all use. Good masks are ones that fit well, covering your mouth and your nose. Not only should you wear one when you're sick and having to go into a public space, but you can also consider wearing them in poorly ventilated and crowded settings. For instance, I frequently wear a mask on public transit during the months I know when flu and COVID are circulating. So let's move on to vaccines and why they're important, and then we'll look at a few different respiratory viruses and the vaccines that help prevent us from getting very ill with them. Here are some reasons for all of us to get vaccinated, whether you are young or old, generally healthy, or someone with many medical issues. Vaccines can help you prevent you from landing in the hospital with an infection. It can limit your illness with an infection, i.e. the number of days that you're ill, and it can prevent you from even getting an infection. It can prevent you from spreading that infection, and it can prevent the rest of your body. For example, vaccines are known to prevent against cardiovascular disease, reduce your chance of diabetes-related complications, and reduce frailty, all by improving your chances against getting infected with these viruses. So now let's look at influenza, or what we commonly call the flu. So what is influenza and why should you care? Influenza viruses are not the same as viruses that cause the common cold. Flu symptoms include headache, chills, and cough, followed rapidly by a fever, appetite loss, muscle aches, and tiredness. You can be ill for days, lose time to work or going to school, or lose out on important activities for all of our Jamaati members, including our retired members, like Kushali events that are coming up, vacations, time with family and loved ones. We know that influenza is one of the top causes of death in Canada. Every year prior to the pandemic, it led to over 12,000 hospitalizations and approximately 3,500 deaths. Internationally, it causes 1 billion infections per year, 3 to 5 million hospitalizations, and approximately 500,000 deaths per year. That's astounding for a disease which we can prevent through good hand hygiene and vaccination. Those at highest risk for severe illness and death are kids under the age of 5 and the elderly, along with people with chronic medical conditions. The good news is that you have access to the flu vaccine every year, and it changes every year to try and match the strains that are circulating. Everyone aged 6 months and older are eligible. It is highly recommended for the age groups that I mentioned before and for those with medical conditions. There are different types of vaccines available depending on your age. What's important to remember is to get the vaccine and not worry about the exact type you're getting. While for our elderly Jamaati members, if you can get the high dose or adjuvanted vaccine, that's great. But if you don't make it to your healthcare provider in time to get one of those, it's okay to get whichever flu vaccine is available. Based on where you live, you can get the vaccines at pharmacies, physicians' offices, or some clinics run by public health. For example, in some places, there may be a partnership between the local public health department and our Ismaili Health Board to have one special clinic at Jamaat Khana. Find out where you can get yours this year. And the timing is important too. I usually say the best time of year to get your flu vaccine is between Canadian Thanksgiving and American Thanksgiving. That allows everyone to have better immunity levels heading into Salgira Kushali celebrations, Christmas, New Year's, and the rest of the winter. Next slide. For influenza, most people will not get tested and simply will get a diagnosis by their doctor based on their symptoms. However, for some people, testing is important, especially if you end up in hospital or live in a long-term care facility where there's a chance for an outbreak. In these cases, antiviral treatment can be started if influenza is diagnosed. And for our Marids in long-term care, if there's an outbreak in their wing or throughout the facility, the doctor in charge may recommend prophylactic treatment for the entire wing or the facility. Now let's move on to COVID-19. Many people ask me, Dr. Meghani, COVID has evolved so much. It must be more like a cold, right? Unfortunately, while many of us have much milder symptoms from COVID-19 these days, due to some underlying immunity from previous vaccination and infection, COVID still causes lots of severe illness and death. We still see a lot of outbreaks in long-term care homes, and many people still die from COVID, especially elderly individuals and those with chronic medical conditions. Pregnant women can also have higher rates of severe illness. So it's important to get vaccinated. So we strongly recommend that highest age groups, so those are 65 and older, people living in long-term care, those who are immunocompromised with medical issues, those in high-risk communities and their caregivers should get the vaccine. It's important to also get the vaccine if it's been more than 6 months since your last infection or your last vaccination. In Canada, we have 2 mRNA vaccines by Moderna and Pfizer, which are going to be available to the general public at the end of this month, but in some provinces are already available to high-risk people right now. These vaccines target the latest variant of COVID-19. You can also get your vaccines in the same place that you would get your flu vaccine. And the good news is that you can get it all at the same time as your flu vaccine and the RSV vaccine, which Dr. Chagla will talk about later. Immunity from COVID-19 does not last long, and we know that the virus is constantly evolving. The latest Omicron variant is KP2, which has caused the wave that we are currently seeing in Canada. So it's important to get the latest vaccine and get the best protection from it. And when it comes to testing, rapid tests are still available, although they may be restricted to people eligible for treatment in some parts of Canada. Most of the green tests can be used even if expired. Some have had their expiry date changed, so be sure to check online. The timing of when you test yourself after getting sick is important too. With the latest variants, there is a smaller amount of virus shedding during the early days of being sick than with previous variants. So it's important to do another test around day 3 or 4. Regardless of the test results, you should stay home until your fever is gone and you've started to feel better. And you should keep a mask on when you go to a public place or meet with others until 10 days after symptom onset. And now I will pass it on to Dr. Zain Chagla to speak about pneumonia and RSV.
Thank you, Dr. Meghani. So I will be going through pneumonia and RSV vaccines. Again, part of being up to date and a lot of changes that are coming. So worth it to have that conversation if you fit into the groups at risk with your provider to ensure that you have access to these up-to-date vaccines. So many people do get community-acquired pneumonia. This is a common illness that drives people to hospital, sends people to their family doctors. And the most common bacteria is pneumococcus, a bacteria that typically lives in our nose and throat and can go into our lungs, causing pneumonia. We do have a very effective vaccine that many individuals may have gotten already who are over the age of 65. Some individuals who are 18 to 64, depending on where they are in the country, may have also received these if they have medical issues. The good news is there are newer vaccines available that are now going through public health and being accessible to the communities. And for the newer vaccines, it is only a single vaccine. So important to talk to your providers. If you've never been vaccinated and over 65 or you're 18 to 64 with particular medical issues, you can get a single dose of vaccine and be protected. If you've had prior pneumonia vaccines, depending on what you've had, there's still benefit for getting some of these new and updated vaccines. They trigger better immune responses and give more protection. And so, depending on what you've got in the past, you can update your vaccines somewhere between 1 and 5 years of your last vaccine. These vaccines can be given with the flu shot, the COVID vaccine. And again, the newer vaccines are single dose vaccines. So easy to get and no needs for updates until better technologies come down the line. One of the new things that's happened in the last 2 years is the ability for us to give RSV vaccines. RSV is a virus that causes a lot of the symptoms that COVID-19 and influenza do. It's been a virus that's been around for a long time. Unfortunately, we've not had many solutions to vaccinate people or treat people against these. But in my practice and what I see in the hospital is RSV in older adults can just be as bad as influenza. It drives just as many people to the hospital. It can make them very sick. And unfortunately, I see people that die of this virus every year. In kids, it can also cause issues. And the good news is this year, we have access to effective vaccine strategies in both older adults and children. So RSV vaccines are available. They've been available since last year. It's highly recommended for everyone over the age of 75. And people between the ages of 60 and 74, if they have underlying medical issues, should have a conversation with their doctors, their specialists, to ensure that they're also eligible for this. But definitely those who are over the age of 75 should be receiving this vaccine. This is a single injection. It's a protein vaccine, very similar to the vaccine we get for shingles or other protein-based vaccines. And it can be available typically through a prescription, either via doctor or via pharmacies, depending on the province we live in. There are a few provinces that are starting to cover this vaccine, but mostly it is paid for either by individuals or if they have private insurance, can pay for it as well. There are some individuals that, depending on where they live, such as in long-term care, that may have access to this vaccine for free. But even though it is not paid for by governments, it's still very important, and particularly for those over the age of 75, as they're staying up to date with their vaccines, that the single dose of vaccine that lasts a few years is another tool in their toolkit to help prevent serious disease and landing in hospital. Now, we're also blessed this year to have RSV prevention in infants. And we know RSV is one of the most common causes for children, particularly young children, to end in hospital. the virus gets into the lungs. It makes them really, really, really tight. And, you hear young babies that wheeze, that cough, that have difficulty breathing when they get RSV. And so, this is a really, really important tool this year that many provinces will have access to, a preventative option for infants to prevent them from getting severe RSV, particularly in the first year of their life. And so there are two strategies that are being proposed and are available. One is actually vaccinating the baby with antibodies to RSV. And this is a product called nirsevimab. It will be typically given at birth for babies. So, immediately after they're born, before they're discharged from the hospital, but can also be given up to 8 months for some of the children, particularly ones that were born this year but didn't have access to a treatment. There may be campaigns to get those kids back in and give them a dose of the antibodies to give them that protection. The other strategy is vaccinating pregnant people with an RSV vaccine, actually one of the same ones they use for older adults, which in a large trial was able to be given to mothers. Mothers then made antibodies, and those antibodies passed to the baby. And as long as those babies are born 2 weeks or longer after the mother is given these vaccines, they actually get protection for at least 6 months with getting sick with RSV. So depending on where you are, depending on what's available, you may be offered either nirsevimab, the antibody at birth for your baby, or the vaccine during pregnancy. Again, this is just starting to go live now, so many people may be approached in the next month or two as our healthcare systems are able to offer this. And it is very important, if you were offered one of these options, to take them, because RSV can have a significant impact on young children, can land them in the ICU, can leave them with things like asthma in the next 5 years. And again, we have seen that these therapies in places around the world, when given to young children, can have marked reductions in how much kids get sick with this disease and really recover as well as they can with this disease. So, just flipping to kids and respiratory viruses. COVID-19 vaccines are available to children. Influenza vaccines are available for children. Again, some high-risk infants and now all infants may get a preventative treatment for RSV. Most kids will have a respiratory virus through this winter. Some have already gotten a respiratory virus at the start of school, and the vast majority can be managed at home. The big things for children as they're recovering from respiratory illnesses is that they get good nutrition, they hydrate, and they rest. If children are fussy or feverish, you can use Tylenol or Advil to kind of settle down the pain. Based on age recommendations, some of these medications can't be given under a year of age. And then, for especially the youngest kids who have a lot of nasal blockage and a lot of mucus in their nose, that you can use nasal saline or suction, so drawing the mucus out of their nose with a device that you can buy at the pharmacy. The things for children to seek medical care for, if they're confused, they're lethargic, they're not eating and drinking well, or they're dehydrated, if they're breathing very noisy, or they're having difficulty breathing, or if their symptoms are really lasting quite some time, it's important to seek medical attention for these, as well as, just based on your concerns about your children, knowing them and how they normally behave. And with that, I'm going to switch it over to Sarah to go through some frequently asked questions and answers.
Thank you, Dr. Chagla and Dr. Meghani. I'd like to bring our panelists back together to answer some frequently asked questions. Dr. Chagla, should I get any of these vaccines during pregnancy?
It's a great question. So yes, so the COVID-19 vaccine, the influenza vaccine have all been studied during pregnancy. They're effective, they're safe. And in fact, there's actually a lot of emerging evidence that women vaccinated during pregnancy actually pass on some of that protection to their infants. And their infants actually do better with COVID-19 and influenza after they're born if they're vaccinated during pregnancy. So this is a priority population. People who are pregnant should be getting a COVID-19 and influenza vaccine. And then the third vaccine that we talk about is the RSV vaccine. And so one of the RSV vaccines is actually meant to be given to pregnant women or pregnant individuals during their pregnancy. And the whole point is to give that extra protection to their baby once they're born. So you may be offered this injection as part of your normal pregnancy. And again, safe, studied in pregnancy, really, really good safety, and really meant to be there not only to protect yourself, but to protect your baby once they're born.
Great. Thank you so much for going over that. Dr. Meghani, next question is directed to you. How many COVID shots do you actually need? And how do you know if you need another COVID shot?
That's a great question, Sarah. And I know that many people are puzzled about when they should get it and how many they should get. So the simple answer is we're probably going to need a new COVID shot every year. It's going to be very much like the flu vaccine, where you get it on a regular basis. It's really important to just basically stay up to date. So whatever the new information is, follow it, talk to your healthcare provider, whether that's a pharmacist or your family doctor or others, and make sure that you know when you're eligible, because based on your age and your medical conditions, you may be eligible earlier than other people are. So right now, we know that we have new COVID vaccines that are really targeted towards the current strains of Omicron, which is KP2 that's circulating right now. So it's important that you get that shot this season, this fall. And with flu shots, it's every year. So we recommend everyone above the age of 6 months get their flu shot every year as well. And maybe Zain would like to also speak to the other vaccines.
Yeah, absolutely. So the other vaccines are a little bit different because the viruses and the bacteria are a little bit more stable in the ones that we're giving. And so we actually have the ability to have, single injections. So for example, the RSV vaccine right now is just a single shot. It's been studied for at least a couple of years that people still get really, really good protection going forward. And so it's only one vaccine. The pneumonia vaccines, particularly some of the newer pneumonia vaccines that are coming, are also just a single shot. So important to talk to your provider. Some vaccines like influenza and COVID, it's really staying up to date on the season. And some vaccines like RSV and pneumonia are really just getting your immunization and being done with it.
Great. Thank you so much to both of you. Dr. Chagla, my next question is for you. One question I hear a lot at the pharmacy is, can I get more than one shot at a time?
Yeah, absolutely. So there is lots of data around us giving co-administering shots like RSV, COVID, and influenza together. And so absolutely, all these can be given together. And in fact, they're encouraged, especially for people where they may not be able to get back to the pharmacy to get them together. And many may remember when COVID vaccines first came out, when RSV vaccines came out, there was a little bit of a precaution, wait a couple of weeks, then get your other. And that really was just because they're new vaccines. We just want to make sure that if there's a side effect, we understand which vaccine it came from. Now that we know, we understand these are safe vaccines, their side effects are pretty minimal, that we can give them together, and we have lots of good evidence and even encouragement to do it together. Just make sure that people are protected for everything going into the season.
Perfect. Thank you so much. And last but not least, Dr. Meghani, another question I get in the pharmacy quite often is, if I'm feeling unwell, should I get a vaccine?
So generally speaking, depending on what symptoms you have, it is safe to get a vaccine when you're feeling mildly unwell. However, we generally say that if you have a fever, it's probably best to wait until your fever's dissipated and you're feeling a little bit better to get your vaccines, just so that if there are some side effects like Dr. Chagla mentioned before, they usually are very mild, but occasionally people can get a fever from a vaccine as well as you're building your immune response to a particular agent that's in the vaccine. So it's important then to try and be as well as possible before you get your vaccine, but not to delay too long either, because it is important to get your vaccines as we're heading into respiratory season.
Excellent. Thank you both so much. Move over to the next slide now, where we'll leave you with some helpful resources to take home. For the latest updates and information, visit iicanada.org, where you'll find provincial vaccination information, more frequently asked questions, and a variety of webinars on health-related topics. For more personalized support and resources, you can contact the Access line by scanning the QR code or dialing the phone number on this slide. This brings us to the end of today's session. I would like to thank Dr. Hamidah Meghani and Dr. Zain Chagla for sharing their knowledge and expertise with us. Lastly, thank you to our audience. We hope you enjoyed today's webinar and learned a few things to help keep you healthy and protected this respiratory season. We will also follow up with an evaluation form via email to provide your feedback so we can improve our programs. Until next time, and ya Alid Mada.